everyone to session 4, Father's Mental Health Impacts on Child Well-Being. We have 3 extraordinary presenters. I am Shari Doherty, the moderator, and I'm the program director for Parent Help Child Find of America. And we provide free problem-solving services over the phone for parents with challenges over parenting time, custody visitation, all the way up through missing children, all missing children issues, with a specialty on denied access and parental abductions. I'd like to hand this over to first Shian, then Hector, and then Armin to introduce yourselves to our attendees.
I am Shian Fisher. I'm a perinatal clinical psychologist who specializes in fathers and mothers' mental health during the perinatal period and the impact on child outcomes, and I'm at Northwestern University.
My name is Armand Perry. I'm a professor in the Kent School of Social Work and Family Science at the University of Louisville, here in Louisville, Kentucky, where I study fathers, families, romantic relationships, as well as co-parenting.
Good afternoon. My name is Hector Sanchez Flores. I serve as the Executive Director of the National Compadres Network, an organization that works with both practitioners and systems, behavioral health systems, seeking to improve the services for communities. And we have a history of focusing, in addition to the general community, specifically on men and fathers.
Thank you all. Welcome, everyone. And I'd like just to quickly take a moment and maybe ask everyone to think about something, a phrase, some words. Basically, I call it the bumper sticker motto. If you'd like to share what your bumper sticker motto might be, obviously they need to be short, so they can be seen from a distance, and pretty clear, unambiguous as to what the message is, so people know what it is that you'd like them to know about you. And my bumper sticker motto, I'd say, for the work that we do at Child Find is, you don't know until you know. That is something that guides our work. And I will hand it over to the speakers now to share what your bumper sticker motto might be. Hector?
Sure. I guess I would say that our life's journeys, including struggles, gives us the medicine we need to lead fulfilling lives.
Thank you. Very nice. Okay, Shian?
My bumper sticker would be that gender norms can have a negative impact on everyone, especially when they're rigid.
Wow, both fantastic. Armin?
I like all of you all's bumper stickers, maybe even a little bit more than mine, particularly given that mine may need a little bit of explanation, which I think runs contrary to the idea of a bumper sticker. But the reason why I do fatherhood is I think this is a big area. To me, in my way of thinking, this is the most fertile ground that there is in social science. And so when I think about my bumper sticker, one of my favorite musicians has a line in the song that says, "I would rather die enormous than live dormant." Right? And so when I think about spending my time doing something that I think is big or enormous, fatherhood is what it is. So I would rather die enormous than live dormant, my bumper sticker.
I am thoroughly impressed by all of them and excited about the conversation based on those answers. I will start, since we're going to go back to the beginning of fatherhood with this particular question, I will ask Shian if you could share, because of your expertise and of understanding perinatal development and the impact of dad's mental health from very early on, can you just speak briefly to the importance of dad's mental health all the way back from pregnancy on through the perinatal stage, which I believe is the first year or so? Okay, thank you.
So yes, father's mental health, we're learning, is actually very important to the family health broadly. And that is right. It starts during pregnancy, that when the father is, going through the experience of just becoming a new father, but the mom is currently pregnant, the way he engages with the mom, supports the mom, and the general involvement can have an impact on the mom and the fetus at early stages. And this continues on through the postpartum period for that first year and beyond, that historically people thought that fathers, since they're not carrying the child, or since they have historically not been as involved, there's no impact. But fathers' mental health, for the depression, anxiety, including even the ways that it might be manifest as masculine depression with aggression or irritability, all these things can have an impact on the family and have direct impact on the child development, even after accounting for mom's mental health. So I think it is important for us to understand that it is at the early stage of development that the father has an impact, and this sets the stage for the future.
Thank you. That's very informative and helpful. And I really appreciate, though, that you're going to bring some insight into from very early on, from pregnancy on, because it isn't a time we necessarily think about dad.
Mm-hmm.
He's there often in the room, but truth be told, right, he's there much sooner. Okay, thank you for that. And I will direct this to Armen. This is a question about adverse childhood experiences, which we call ACEs. And since we are talking about the impact of mental health and substance use on children, maybe you could help enlighten us a bit on why substance use and mental health challenges are listed as the two of the adverse childhood experiences.
Sure. So for those who, again, I would imagine many, if not most of us, are familiar with the ACEs by this point, but for those who may not be, we're talking about adverse childhood experiences, or as they oftentimes refer to, ACEs. These are traumatic events that occur in a person's life between 0 and 17 years old. These are traumatic experiences that have been examined in large-scale studies that were commissioned by the Centers on Disease Control in order to track the impact of childhood trauma on health outcomes throughout the life course. What we've learned is that people with ACEs have been associated with many number of lifelong challenges, whether they be health, mental health, violence, and even violence victimization. Unfortunately, we know that ACEs are really, really prevalent, with some studies estimating that up to 60% of the adult population having at least one ACEs and 16% of the population having 4 or more. It should also be noted that women, as well as racial and ethnic minorities, are at a greater risk for experiencing 4 or more of the ACEs. When people have ACEs, they're much more likely to suffer from negative biopsychosocial outcomes. Studies have reported that 78% of intravenous drug use can be attributed to higher ACEs. Upwards of 67% of alcoholism can be attributed to ACEs, and around 65% the risk for suicide can be attributed to ACEs. And so identifying and addressing ACEs through treatment as early as possible is really, really important, because the sooner these things are addressed, the smaller the impact, and the more likely it is that a child will remain resilient and have the potential to thrive. So for all of these reasons, having a parent who's experienced a mental health or alcohol and or substance use challenge is considered an ACE, because of the ways in which those challenges will likely distract from or take away from a parent's ability to do things like earn a living or engage in the type of authoritative parenting, which is why they're recognized as the optimal parenting style, characterized by a combination of firm boundary setting with warm nurturing. And so to the extent that ACEs take away from a parent's ability to do those things, they negatively influence and impact the parent's ability to be there to promote their children's healthy growth and development in the ways that we like to see them do.
Thank you. Thank you so much. I mean, for the not only, touching on the ACEs, but also that actually was a wealth of information too. And it seems to me that the list is growing 4 ACEs from when we first started, and including community violence and other impacts on children. So I appreciate the input on that. It is very important. I would like to turn to Hector and the National Compadres Network,
Yes.
which is your baby, which is your agency. Your focus is on culturally competent supports. Is that right? Maybe you could share more about how the importance of the connection of that type of work with being involved in building up relationships, parent-child relationships, obviously, particularly the dads that you work with.
Well, I would say that Dr. Fisher gave us that synopsis at the very beginning of his bumper sticker, and that is to really reflect on the rigidity that we have sometimes on what it is that being a father is. And when we talk about taking a lens that is broader, that is inclusive of diverse communities and diverse fathers, basically we're asking practitioners sometimes to abandon maybe the structures that we've inherited and we learned from our experience, especially when it's different from the people that we serve. So if I, for example, in certain places, fathers are overextended and have to take on multiple jobs to make ends meet for their family. That's not the model that we frequently think of when we think of father. We think of one job, being there all the time. And not all fathers have that privilege. So when we think about doing this, we also presume a couple of things. We presume that fathers want to be present. They want to be engaged. That's the default that we teach and we promote. And sometimes systems and behavioral systems, they look at the deficit model. That gentleman, that man does not father the way I think fathering is going to be. And it's rigid. And so recognizing that different communities, for a variety of reasons, parent and guide children in different ways. And we want to instill that conversation that says, if your child is important to you, that is the goal, to strengthen the connection, to strengthen the depth of the relationship so that I can fulfill my job as being the kind of father that I wish to be and supporting them along that journey. Now, when we intersect with stressors like mental health, that requires us to still be even more in depth about how it is. Are there resources in the community where this father lives that would support them in that journey? Does that father trust those services? Are the providers able to let go of that rigidity and say, we'll walk with you in this journey of growth and development, and your experiences are there as a teacher? How do we get you to convert that to medicine so that your child experiences fewer ACEs, right? Hopefully much fewer, right? That's the ultimate goal. But it really requires us to kind of abandon the rigidity, look at the strengths of communities, and build from those strengths. And that's not an easy muscle. That's not a muscle that we develop early on.
Okay, thank you. And I appreciate, though, that we are bringing up the need for flexibility, for valuing families as these unique beings that they are. I don't think any of us appreciate other people making assumptions about us and our families. And exactly as you are pointing out, Hector, is the type of family individual that we want to be and what we have to contribute and what our interests are. So I'm happy that we're discussing the need to, as we say at Childfind, we take every family in a bubble. Everyone lives in a bubble. And though there might be some commonalities, but you're right, goal setting needs to be unique to and sensitive, obviously culturally sensitive as well to those families. Thank you for that. I'm going to move to co-parenting, or parenting apart, as we call it. We say parenting apart when only because the language can be so heavy when we have pretty much stopped using custody visitation because those are prison terms. We use, and they don't give us a lot of the flexibility that you are all bringing up. So maybe we can speak to the impact that a mental health challenge or substance use misuse challenge that's being experienced by dad is going to impact that parenting apart relationship. I think anyone can jump in on this. Maybe Armin, you would like to start us off?
Sure. And I'll first say that parenting apart is new language for me, but I appreciate that. I'm definitely going to be adding that to the lexicon to replace some of that more deficit language that you were describing earlier on. So I appreciate that. When I think about parenting, I feel like we can all agree that parenting is extremely difficult, even under close to ideal circumstances, right? So I've heard it said that we don't raise our children in a greenhouse. And so we can't sort of artificially manufacture the conditions under which we raise our children. And so parenting is something that, again, is extremely difficult for all of us. My sense is the more layers of complexity that we add to it makes it even more difficult. So this is certainly the case for people who may be parenting apart, and maybe even exponentially more difficult for people who are parenting apart while also struggling with a mental health concern. The other thing that I like to point out in response to this question is that in my own research, I've found that empathy plays a critical role in the development and the maintenance of an effective parenting apart relationship, right? The challenge there is that by definition, empathy requires a level of emotional intelligence and the ability to be selfless and to think about the condition of others, which is going to be extremely difficult to do if and when a person is struggling with a mental health concern, particularly if that mental health concern is either undiagnosed or untreated, right? And so given some of the challenges that we have around access to mental health treatment and the challenges that we are certainly working on, but still exist as it relates to bringing mental health into the mainstream of medicine, again, I think only exacerbates some of those challenges. So those are my thoughts around the ways in which parenting apart relationships can be impacted by parents, and particularly fathers who may be struggling with a mental health concern.
Yeah. I could add a little bit there. And you know, when I think about the apart part, right, I think about all the reasons why there may be apart, right? And sometimes we jump to the conclusion that, you know, something is amiss, and something can be amiss, but maybe a choice as well. Some families choose to structure themselves that way. And so we shouldn't always view that part as the deficit, as away from the default of, I would argue that sometimes there's people in the same home that are parenting apart, right? And so when I think about those relationships, it's about really instilling the ability to have mutual respect for one another, the role that two parents have, right? The more parents a child has, the more resources and assets that could be constructed, right? And so I would hope that when we're faced with those circumstances where the apart means perhaps different physical homes, right, that we're still instilling this sense of like the focus is on the child, and we're trying to build a connection that strengthens our ability to support and love that child. Obviously, when we intersect with mental health, that could be a profound disruptor. And so we're looking at ways to construct the support for the parent that may need that extra. And if it's in this, if we're talking about fathers today, so what are the levels of care that father would need in order to be present, respectful, loving, and nurturing to their child? Right? Is it a high dose service of a psychiatric care that perhaps intersects with medication? If that's what's needed, is it available? Is it a lower level psychologist or counselor that is to provide some support and guidance and help them achieve the goals that they're seeking to achieve as fathers or co-partners or parents apart? And then finally, if neither of those are available in the community, how do we construct circles of support within the community in spaces that they can get to easily, and build networks of support that say, hey, I see you, I'm here for you. You may be here for me too. And it's not necessarily strictly therapy in the sense of the way we view mental health services, but can be therapeutic, that introduces a healthy way of growing that maybe moves us up that ladder to the services that we need. And hopefully the community would be responsive and have those services available for the fathers, because the ultimate goal is nurturing and loving and supportive care for the children that we're responsible for.
Thank you. Thank you. Sheehan, do you have something to add?
Yeah, I was just going to add that, kind of going along with the idea of also making room for different cultures, that in the United States, there are different cultures and some don't always have the same rates of what people consider as a traditional family. And that, unfortunately, it starts to become demonized, where there's an ideal of what a family should be. If you're outside of that, especially if you think about mental health within a contextual view and also policy view, the policies support a certain particular family. If you don't fit that mold, that does create a lot more stress for the family and therefore puts each person vulnerable for developing mental health issues. So even making it clear that's not even, mental health, of course, not someone's fault, but all the more so, are we doing things to support the environment, or are we saying, hey, you have to fit into this, square hole, you have to be the type of person and the type of family we want you to be. And if not, we don't support this parenting apart in a way that is considered healthy and that we can make sure they have access not only to services, but even feeling more normalized versus feeling like they have to fit a mold.
Nice. Thank you. Thank you. So again, we're really stressing that there have to be some maybe creative approaches. Maybe there on the horizon, there are some ways of addressing this that maybe we haven't necessarily done or tried before, or some just outside the box thinking a bit when it comes to some pretty challenging situations. And some there isn't much worth, from what our experience at Childfind is, that can happen to a person than having your child taken from you. Our founder actually had her child abducted during she was sent during a court-ordered parenting time, and the child was taken overseas for 8 years, and no one had really much response to it. There was no law enforcement remedy or a court remedy at the time. And this 40-something years later, things have changed substantially. So again, it's good that we continue to bring up this. You need for unique approaches and creative and maybe more realistic to what the actual situations are that we're dealing with. Since we have your good minds here on the issues of mental health and your experiences, have you developed some kind of protocol, or do you work with red flag indicators that a dad may be entering into more less of a chronic situation, but more of a mental health crisis, and that you have some concerns? And what would be those red flags that maybe you can share with other practitioners and dads themselves? And what might some of those responses be in your experience? That question could be for everybody. Hector, do you have experience seeing particular red flags that you can share?
Well, I guess I'm looking at when you have a deep relationship with somebody, right? Whether you're the partner or a person around, my hope is that we know one another, right? And you see if an individual is retreating into isolation, that something may not be well, right? And that doesn't necessarily mean a red flag, I think, the way we associate it with a crisis. But if you're connected to people and they're beginning to recognize things that are not common for you, right? You're in isolation and not coming out. Maybe you're relying on something to get through the day that historically you didn't do. Maybe it goes from having a beer at the end of work to having multiple beers at work, right? Those are the things that you can begin to notice, right? But that really requires you to be connected with somebody that can say, hey, Hector, what's going on, right? And that's a different approach than a red flag. Now, obviously, when things spiral and there's a crisis, then obviously there's things that you have to look at for safety and well-being for the individual suffering that experience and the people that are around them, right? So my fear is that we become very hypersensitive to like, what's the red flag? And therefore I go around looking for red flags, right? And then fathers are potential triggers of red flags. And if we go back to what was said earlier, that if we're there to support them in their role to be fathers, then we would look at those as indicators that they need more support. That's hard in communities where the supports are non-existent. And I think Dr. Fisher at the very beginning said this whole parent journey starting at pregnancy was oftentimes for very good reasons for the well-being of the mother, especially if you're African American in the society. You need some special care because the care was not designed for mothers that are not seen, and therefore we see the real challenges of birth for some segments of our community. If we do the same thing for fathers, we'll begin to recognize these are the behaviors that we want to build within fathers. We want them to be supportive, and yes, be aware of the red flags, but let's not go around hunting for red flags, because many fathers at some point in our lives struggle in that relationship, right? Of how it is to be. It may not be severe, but there's adjustments that we have to make, right? And the more supports I had, others have, the more easily I can make that adjustment by simple awareness. I don't know if that answers the question, but the term red flag triggered me, right?
Okay, thank you. Yeah.
I would add to that. I think that, when you think about men's health in general, men typically ignore different signs at early stages of their health, like whether it's about medical conditions like diabetes or heart disease, other things that they sometimes have symptoms for years or even like backaches. And then when it becomes a crisis, then is when there's intervention. So I would think about it similarly for mental health, is that we need to lower the threshold. We don't need to feel like, okay, you are at crisis or at a point that you're having a severe condition before you get support. And even as Hector mentioned, kind of the range of supports and types of interventions that could be available, men need to be more aware, especially fathers, about their health in general. And so therefore, if you are starting experiencing changes where your functioning is a little bit different, you can't focus as much at work, or you're starting to notice as things we'll call it the externalizing behaviors, like drinking a little bit more, you feel like a little more irritable, then it might be start to do early intervention, even your own brief ones. If that doesn't work, or if it starts to worsen, then from there start to escalate what type of intervention, but not being shy about it or feeling like there has to be some severe threshold that's met before you actually start to take the signs seriously. And of course, be able to be open to people in your environment, your loved ones, like your partner, or even friends, family, those in your community who might say, hey, you seem a little different, to not be defensive, but be open to listening. Hey, these people love me, they know me. And if they're seeing something that maybe I don't even see, maybe it's time to make sure at least that I'm taking it serious enough to follow up on assessment, if not intervention.
Can I just, thank you, Dr. Fisher. I just want to add that when I mentioned early the range of providers, right? And you start with psychiatric care, and then you go to, in some communities, those may be barbers, right? They may be the people that are your neighbors, right? They may be a minister, a pastor, or an imam, right? People that get to know you, that recognize you, that you trust, right? So when you were sharing that about early intervention before it's crisis mode, really supporting communities to say we all have eyes to support one another, not to diagnose or categorize, but for some people, a long relationship may be with their barber, and that barber may know dimensions about them and the people that are there that might be helpful to say, hey brother, it sounds like you're struggling with this right now, right? And that becomes the normalizing thing, right? I know a lot of people that are struggling with this right now too. And coming out of COVID, we can all have a shared sense of what isolation feels like.
Thank you. Thank you. I will bring up just one important thing that I had learned during my training in suicide prevention, being able to ask, just as you're saying, Hector, actually, asking someone if he or she, but we're talking about dads, asking dad if he is thinking of killing himself is actually a very good step to take. So if it is somebody, we have been talking recently in the field about relational health, meaning those supportive, important connections that we have to other people, giving us, the ability to be healthy mentally, emotionally, and so on. But I just did want to point out that it's not going to implant an idea into someone's head that he had not already had. And you can always ask afterwards, and do you have a plan? And are there phone numbers that I can give you? Are you open to taking some resources from me? So I just thought that was an important thing that I wanted to share, though, about if it does come up in someone's life, be it the barber, be it a community member, being it another professional involved, a family, that it's okay to ask that question. It might be something that he was hoping somebody would ask. I would like to move to parental depression and interparental conflict rather, and ask Sheehan, what do we know about the connection between interparental conflict and depression?
Well, for one, parental depression and interparental conflict are highly correlated. One of the most highly correlated with depression is interparental conflict when you think about other factors that go along within the family. In addition, just as a partially side note, when one person is depressed, is also a higher likely risk that the other person might have symptoms of depression. So we're thinking about a family dynamic where one or two people are dealing with depression. When you're depressed, you're not at your best state. You're not able to think through things the same way. Your risk of even manifesting your distress within irritability or ineffective communication. All those different factors can play into that interparental conflict or leading into it. And therefore, when people are feeling already personally overwhelmed and then they're not their best state in their relationship, that leads to this distress and many times discord that can lead to conflict and retraction, that process starting to bubble up. And without guidance, many times people once again have a high threshold before they go see a couples therapist or try to get intervention in any form. They try to do it on their own, which puts them at risk of this worsening over time. One of the hard parts, even when you do couples therapy, is not only about the presenting problems, all the history. People are like, well, even if this person changes now, I'm still mad at them for what they've done over the years. And it takes a lot to undo that. So it would be better to try to encourage couples that when you are struggling with your mental health and noticing this spilling over to your relationship, to try to make some change early, not only for yourself and going to your own individual treatment or support, but also making sure you're taking seriously, how do we change this dynamic and maybe even get external support to do that? That's something also I think that is something that needs to be supported within our communities and even within policies to make it easier and more available for people to think through about their interparental relationship as a health outcome that's important for their family health.
Thank you. Thank you. Can I ask what you used the word retraction, and I'm not sure.
Or as in people start to retreat, they start to pull back, like they start to, a lot of times you see in a couple, one person pursues, the other person starts to retreat and get smaller, and therefore it creates even more of that dynamic within the relationship.
Perfect. Thank you. I will remember this. I also would like to touch on, while we're talking about the impact on children, but specifically child development, we were talking, and Armin was very eloquent about talking about the ACEs Are there specific developmental stages child stages where we believe that negative outcomes are more likely when there's been exposure to a parent who is struggling with mental health? And I can start with Armin, if you'd like to answer that.
Sure. I think that perhaps my colleague, in particular, Dr. Fisher, may be really, really well equipped to respond to that question based on this research with parents of infants. But I would imagine that those early stages are formative for any number of reasons, this being one of them, right? I think that the time from 0 to 5 in many contexts creates the circumstances under which build a foundation for what happens for a good bit of the rest of our childhoods and maybe even our lives by extension. And so I would imagine that time is a critical time for folks to get off to a good start. And for whatever reason, if they aren't able to do that, I can see how that would have some lingering and lasting effects. But again, my colleagues may be better equipped to speak more specifically to that from a child development standpoint, ages and stages and across the life course.
Okay, thank you, Armin. Yeah, it's getting thrown to you, Shehan.
I do agree. I don't know if there's specific research that compares, but the research is supporting what Armin's saying is that early, two parts. One is that, yes, the child's development, if it's affected early, it sets a stage for the long-term development. But also that's because simultaneously, the earlier the parent is developing depression, you see that longitudinal trajectory of the parent's depression. So now the child's not only being exposed early, but is also being perpetuated over time that the parent is still struggling, especially when it's untreated. You see that there's a trajectory where the parent, even for fathers, I know Craig Garfield did a study looking at the first 5 years of the child's life being, or the father's experience of being a father is the highest risk of developing depression or continuing depression. So therefore, if the child is exposed to that from 0 on, and the father is going to continue to go through that child's whole early development is being impacted by a parent who is suffering. And therefore, this is concerning, especially as that continues to early, later stages, that when the child's getting to, puberty and other stages that increase the risk of them developing depression or anxiety, now this child already has this earlier developmental experiences that now tie into even the genetic risk and the hormonal changes, and that therefore is a thing that will perpetuate. So it is good or essential, I would say, to think about that early intervention. Only anything when you think about health, like the earlier the intervention, the better. And if the health outcomes of the parents going to affect the family house, you need to really understand how much we need to do to make sure both moms and dads are healthy.
I want to just add that if I was a father struggling with mental health, I would love to hear what Dr. Perry and Dr. Fisher just explained, which is it's an imperative to say you're important in the life of your child's health, right? And if you were to explain that your well-being is really, I think we understand this in our spirit, but to really, have Dr. Perry say, your well-being will affect the well-being of your child as they grow. And then Dr. Fisher say, and if you don't treat this now, this may continue for a long period of time. What better information for a father who's struggling, particularly in the early stages, like, I can fix this, right? I can begin to work on this. I wish there was these kinds of providers in every community that would reflect that, so that I would go, oh, and then if you just add, and there have been other men and other fathers that have struggled with this, and their children grew up to be healthy and fine, right? You are not a walking risk factor. We can do things to support you in this process.
I was just add to that. That's a great point, because that's where many times you can get buy-in. Unfortunately, just because of the masculine culture, men aren't willing to take care of the health for themselves. But if they actually start to learn and hear from professionals, oh, your health actually does impact your child. Now someone that they love, that they're heavily invested into their well-being, would be the many times a motivator for them to even take care of their own self.
That's perfect. And on a personal level, I will be sharing much of this information and using it. My daughter is pregnant. She's due in July, and the dad, I have had, basically I make a beeline for him often to make sure that he's engaging and engaged. And he last night mentioned something about my daughter's baby registry, and I pointed out, no, it's yours as well, and you can put things on there if you like, which just blew his mind. But I'm afraid I might have given him a terrible chore of having to start researching things he might like. Thank you. Those were wonderful and very helpful. The DSM-5 would be basically the collection, the list of all of what are considered the diagnosable mental health illnesses. Basically, years ago, perhaps, I believe the DSM-1, maybe there were about 100. The current incarnation, there's about 300 of them. And the reason I bring this up is because I think that you, all three, might have some thoughts on when and how looking to a formal diagnosis can be helpful, and when can it possibly be unproductive or possibly harmful when we're looking at putting possibly a name to something. So anyone can start that discussion.
I think you said it, right? I think that it's important for us to be able to name, right, these things. Sometimes, and again, my colleagues have mentioned this and alluded to it, sometimes men are socialized to attempt to brush things off or to create a sort of really, really high threshold before action or intervention is warranted. And I think sometimes that's related to the idea that they're taught and trained and sent messages that to be a man is to either ignore or not be impacted by either physical health or particularly mental health concerns. And so to the extent that we're being specific and we are equipped to identify and name these challenges, I think that that's a good thing. I think that much like anything else, as long as what we aren't doing is, as long as we aren't using those things to label, right, and to stigmatize folks, I think that there is a place, right, for official diagnoses as it relates to being able to accurately assess what it is that may be concerning, so that folks can be as best equipped as possible to treat and intervene. I think, excuse me, I think it's also the case that you'll find people who will seek treatment and be prescribed a treatment regimen that oftentimes initially doesn't always work as well as they would like. They may be wrestling with or suffering from side effects from a medication or something along those lines. And then you'll see people discard their regimen. And that leads to challenges, because one of the things that we know is that oftentimes it takes a couple of iterations of a treatment regimen in order to figure out the right sort of configuration. And again, what we're talking about at its core is we're talking about being as precise as is possible so as to come up with the most accurate assessment, which can lead to and inform the most tailored and specific intervention approach. And so I think all of those things speak to the importance and the necessity in some cases of being able to name specifically the diagnosis or diagnoses that people are dealing with.
That's obviously a really, really interesting point but I would like to maybe jump on what you were, add to who's doing the diagnosing. And I think it is right. It is vital that the person doing the diagnosing has the education and the ability to correctly diagnose. in order to engage those goods right. Because I will say we talk to a lot of parents who diagnose the other parent.
Right. Yeah.
There are some terms, yeah.
Yeah, absolutely. What was left unstated, but implicit in my response was indeed the clinician is trained and has the requisite skills and or experience to be able to do the diagnosis. Absolutely.
Yes, perfect. And yes, it was absolutely implied.
Can I add something that Dr. Perry said, that the diagnosis has a purpose, right? That it's linked to a purpose so that it's not the label. And I think that that's really, that there's a really good distinction that he guided us to, that there's a purpose for this. And usually it's access for services or compensation for services. And all of those things are linked to that. But he also said it should not serve as a purpose to label people, right? And I think that sometimes we struggle with that, so that when somebody who is diagnosed with something comes before me, I know this person because I read the diagnosis, and that's not a good practice. I would hate to be viewed by the deficits that other people have identified in every space that I walk.
I think also just throwing out there too, I think it's important to consider the diagnosis and how it's constructed, because we know that for father depression, it looks a little bit different than traditional depression. And therefore, if we're just using like kind of the typical definition of depression based on the DSM, we might also be missing. So I think before we even jump to adding like a new label, we need to really make sure we understand what depression looks like in fathers to make sure that the symptoms we are including is actually reflective of the individuals.
Okay, excellent. And really excellent points about labeling. Labeling can basically set someone on a trajectory or a downward spiral that is very, very hard to kind of climb back from. So thank you. Hector, you had discussed healthy connections, and that's a term that maybe it's beautifully broad, and it's non-judgmental. And I'm wondering, when would you like us to use that term, healthy connections? What would you replace if we're going to say healthy connections? What would that be in lieu of?
So the goal is to nurture as many healthy connections as we can. But let's look at the role that we're alluding to here throughout the conversation about the role as fathers, right? And so, at the very beginning, that wonderful bumper sticker that says "abandon all rigidity," right? That is there. And I'm not saying like not setting limits. That's not what I mean. I mean just like that we're constrained with an identity, right? A father is imparting wisdom only. I am the authority figure, right? That could become really tough, especially with somebody who's struggling with mental health, because the way I interpret that may not be healthy. But if I say the goal of us working together is to strengthen the connection to the people that surround you, right? With your child, with the partner that you're parenting apart with, maybe the other support systems that you have that surround you so that they can guide and support and you can listen, right? There's many ways that we've seen healthy connections happen. Sometimes you'll see non-biological family, the role of uncles or aunts, right? Grandmothers, aunties, right? That can be part of strengthening healthy connections. And so if I learn to have healthy connections with a variety of people, it takes me out of that rigidity of like, I am the authority figure in the family. And sometimes fathers have to function in that role. That may be necessary in moments. It's not necessary for living in that role for the rest of our parenting lives. So what does it look like to have a healthy connection to a 3-month-old baby, right? What does it look like? What role do you have in holding and nurturing? How does it look in a 5-year-old, right? And how do you strengthen the connection to that so that child says, that's my father, right? How does it look like in an adolescent or a teenager? All of those roles may be different in strengthening connections because, but we don't oftentimes view it in that with that goal in mind. But it's been exemplified many times by people that were not, for example, formally trained, right? My grandmother knew how to do that with her grandchildren. My father, who was not formally trained in parenting, knew how to do that with his children, right? So this is not something that you only learn through didactic education, but you can learn by absorbing it from the environment that you're in, and you can observe both healthy connections and then sometimes people that are struggling with unhealthy connections and say, I don't want to be like that, right? I don't want to do that. So we can learn from that journey, both hopefully from really positive examples, but let's not ignore that sometimes we learn from things that we've seen that we say, I want to change that.
Thank you. Thank you. And it does bring me back to when Armin had mentioned authoritative parenting, by the way, which another session for another day, but really nice to remember that. But there are terms that people in the field are using commonly, and we've moved away from things like deadbeat. And as I said at Child Find, we're really careful to not use some language that we kind of started relying on, dramatic, calling it baby mama drama, or we don't use the word unreasonable because people have reasons for what they do. So we're expanding the language so that we can expand the way we look at possibilities and about our dads. And I'm wondering if any of you have come across some terms that have occurred to you as something that you believe we maybe want to reconsider. That's for all of you.
Well, I think two things I highlight. One is just that I don't necessarily have a replacement. When we say single parent, especially we say like single mom, we assume that there's no father in the picture. And many times, like was mentioned earlier, the father might be heavily involved or equally involved or even more, but we just assume that single parent automatically means there is only one parent, even though there is actually a co-parenting relationship. And once again, that fits into the ideals of what an American family should be. And when things are outside of it, it's almost, even by using that term, kind of stigmatizing. The other part, which is hard, once again, not to necessarily replace, but to figure out, is that we use the terms mother and father as euphemisms. We kind of use them as primary parent versus secondary parent. So we mean we're saying it, and we need to be careful of that because that doesn't fit to all the family models and also pushes people to feel like they have to fit this family model. Well, now I'm the mom, I have to be primary, or I'm the dad, I have to be secondary, and it really is limiting. So not necessarily change the term, but the hidden meaning in the term needs to be addressed, because it is not necessarily fair for all families to be pigeonholed into this role.
And I would completely agree and concur with everything that Dr. Fisher just mentioned. If I would add anything to it, in addition to some of the other things that we talked about, parenting apart and co-parenting as opposed to baby mom or baby daddy, so on and so forth, I think something else that's important for us to think about is we oftentimes use deficit focused language to describe marginalized communities. We'll talk about folks being disadvantaged. We'll talk about folks being underserved and so on and so forth. And so I think when we peel back the layers, if we're students of history, we know that the reason why these communities find themselves in these places and spaces is because structurally there were willful and intentional efforts to put them in those positions, right? And so some of the language I've seen here recently, rather than describing communities as disadvantaged, I've heard people using language like historically excluded, right? So it's to speak to the intentionality behind the structural disparities that exist and how they were coercively created and maintained. And so if I could add that, I'd like to sort of drop that in as well, historically excluded.
So what if we were to replace these things as that there's a if you will a deep level of sacredness of the role of parenting a child, whether it's you're the mother or the father, right? And then not just speak to the things that we learn, the important things that we learn about child development and how to support a child through the course of their life that we can learn, right? Those are learned type things, but we're learning it with a purpose to guide and replace these terms that historically are euphemisms of othering, right? They're things to other certain types of parents, right? My father spoke with a thick accent. It was presumed that when he spoke English with a thick accent, that perhaps he wasn't smart. People overlooked that he was fully functioning in a different language, right? This was his second language, right? And so there are things that carry biases of othering. And anytime we encounter this work, especially with people that are struggling with trying to be good parents, and they happen to also perhaps struggle with some level of mental illness, that we should always be appealing to the higher sense of their goals, of what they are trying to achieve, and be completely supportive in that, and not be attached with what it looks like. That it may not look the way I constructed my family, but their construct may be better than the way mine was.
Thank you, everyone. I'm going to encourage you all to write a book together. Are there collaborations that you would hope to see that maybe you'd like to, if you had a wish list, what might those collaborations be as far as approaches, services to building dads and families up? It's a big question. I'm sorry. But yeah.
Well, I would say one is just that it partially needs to be bottom up. We need more training in it during grad school or during your training programs to make sure people even are understanding it within mental health. And then from there, having more providers available to be able to actually support the families. And then on the other side, from top down, is like all the different policies like parental leave and other things that would support like access to services, making sure that it is not based on gender. And of course, we're talking about mother, father, but of course, other non-birthing parents, that we need to make sure that all the policies are supporting it. And then from there it goes down to like culture, making sure it's normative, because you see, even with medical providers and researchers, we're still human. So we have our own cultural views, and sometimes we impose those in subtle, if not direct ways, and having engaged with families that can be isolating for the fathers when they're struggling, that they don't feel there's a lifeline, that someone will be there to support them. So I think that we need to kind of close the gap from both ends to make sure that there's enough support available, so that when someone has the courage to speak up, there is a system of resources available to them.
Thank you. I like the courage to speak up, by the way, the phrase. Bumper sticker.
I will also add that, here our conversation today really centered on, for example, the support of fathers. And then we even use terms like, we presume that it's the primary relationship in the life of a child is a father and a mother, or two parents, right? Whether they be mother and father, two dads or two moms. But that there are communities that inform us because of the great way that they have built community. The Native American community that views, yes, the parents are very important to this child, right? Primarily they are, but the whole community embraces them, right? That's a lesson to the rest of us, right? That we think we embark on this of like raising a child as a parent, and we're important, and yes, we are, but we ignore the extended kinship that exists around us that could be really supportive to us. And so when I think about collaborations and community, wouldn't it be wonderful that our children had many loving and caring adults that were interested in their outcome, really supporting them? That would make my job as a father easier. I've been blessed that my children have people like that. And I know that they are not going to say the same things that I am identically, but hopefully it rests in the ears of my children in a different way. And so we think sometimes in Western structures, but sometimes indigenous structures can really inform us, right? Like, the old Maasai warrior welcome, which was, how are the children, right? How are the children? I'll bet that in many indigenous cultures, they center the growth and development of children, and everything else is secondary, and we need to support that.
Yeah, absolutely. I would add to that the African proverb that says that if you want to go fast, go alone, but if you want to go far, right, go together. So it speaks to the collective, and it also speaks to the collaboration that you were alluding to in your question. If I could add something else, and this is sort of a reinforcement or a doubling down of sorts, that if we are going to arrive at solutions to these issues, it's necessarily going to take a multifaceted approach, which will include work at the micro or the individual level, the meso, small group and community level, and as has already been mentioned, the macro, which is the policy and structural level. However, my sense is that the quickest and most immediate way for us to begin to arrive at solutions to some of these challenges is for people like us, practitioners and researchers and individuals, stakeholders in our communities, is to impact our immediate circles of influence by encouraging the men around us. And you talked about this, Sherry, with your daughter's co-parent. And engaging and influencing the people in our circles of influence and encouraging them to be whole human beings who experience a range of emotions and affirming them when they do so. And then also speaking out in situations where we see and we hear of men being discouraged from expressing their vulnerability. I think beyond that, it's important for us to advocate for policies that would expand coverage to mental health services and provide us so that those resources can be readily available to people. In preparation for this session, I was reading a study that was recently done by the Fatherhood Research and Practice Network, and it concluded that many states across our country, the percentage of adult males who are uninsured regularly hovers above 15, and in places like Georgia, Florida, Mississippi, Oklahoma, and even Texas, that percentage is well over 20. Right. And so when we talk about the challenges that folks are facing in securing the types of resources that they need, we know that we still have a lot of work to do, even though much has already been done. Still a long way to go.
Thank you. I'd like to end on a positive, encouraging, forward-looking note. Are you aware, any of you aware of something that's happening in the field, something that you've seen, something that you're encouraged by when it comes to building up, strengthening, supporting strong fathers and families? Anyone can take this. Hector, is there something that you have a very unique, beautiful perspective from the cultures that you're so familiar with? So
I will say one of the horizons that is really promising is really recognizing the diversity of our families and our fathering and parenting that and moving away from like these really strict structures, right? Things. And so that's one thing that we can begin to introduce into academia and the preparation side. So people are not leaving thinking that there's I don't think people do that as much, but reinforcing it. The other thing that's on the horizon, I think, is that we're coming out of a pandemic. And I think that for the younger population, younger men, they're recognizing that mental health is an important aspect of their lives, unlike perhaps when I was growing up, right? It was seen outside. Now it's very real. And we should be developing strategies that say, yeah, it's good for you to practice and be aware of your mental health and seek the support that you can, but also kind of recognizing that for some young people, fatherhood is probably part of their journey. It's not part of everybody's journey, but it's part of some of them, and really assessing about how it is that we can prepare. You alluded to this, your conversation with your daughter's partner, that he didn't see himself as part of this registry, right? I don't know if I would have either, right? Because it was not part of the preparation, right? I don't even know what I would have put on a registry of that type, right? But also beginning to let us know, for example, like, be prepared for whatever you get as a child. Our children are sacred, right? They're gifts to us, right? You may struggle, but struggle with a purpose. Let your child be your teacher as well, right? The child will let you know who they are. How do you love that child for who they are and nurture and guide them? All of these things I don't think were part of parenting or preparing for parenting, but now you hear it much, much more, right? And, maybe we'll get rid of some of the things that create these limits, like, well, I got a boy, a gendered boy. This is what it's going to be like for the rest of their lives, right? Like I can envision that. No, let the child be the teacher for us, right? And it might create less stress and less pressure. So I would say that would be a real good thing for the horizon for those people that are working with young parents to inform them.
Thank you. Thank you. Sheehan or Armin, briefly.
Sure. For me, this is quick and easy. I'm encouraged by what we've been doing for the last hour, right?
Yeah.
When I was a CPS worker in the early 2000s, there was no version of what it is that we just did as it relates to talking about discussion related to resources for fathers and the ways in which they can be supported and uplifted in their efforts to take active roles in their kids' lives. So I'm encouraged by the fact that I'm walking away from this session knowing more about the cutting edge research of Dr. Fisher and the cutting edge practice of Hector, and knowing that the people that I encounter, point them in the direction of folks on the front lines doing really, really good work, attempting to move this agenda forward.
Thank you. Thank you. Sheehan, how do you feel about closing it out?
Well, going along with that, that's kind of what I was thinking, is that when I was in grad school, this was like a newer topic that I was interested in. I was just thinking about, wanting to do perinatal work, but one thing about fathers. I want to be a father one day. And now at this stage of my career, it's actually starting to blossom. And I do a lot of work internationally. My focus on, I lead a father special interest group that's international across all the different continents, thinking about where fathers' mental health is important in different cultures around the world, not just within America. So I'm hoping that this becomes not only a national, but international movement toward really considering this within the research and clinical practice, and even learning from other countries. I think America can go a long way for learning how do we support families in other countries and seeing how we can apply that here, rather than viewing it as if we're the know-it-all. There's a lot that can be incorporated into how we approach families, and specifically how we support dads through this transition in their life.
Okay. Thank you all so much for taking the time out and bringing that extraordinary perspectives and knowledge. And I really appreciate the time. And I hope that somebody who is watching is going to hear something that is at least, if not life-changing, but encouraging and good to learn. So thank you very much. Thank you, everyone, for sharing so much wisdom. And we're going to take some questions now from some participants. And there's a very, very important question to start off with, which is, where can I get those statistics on ACEs? Who is interested in answering that question?
I'll jump in. The question may be in reference to some of the data and stats that I shared. That information is available on the CDC website, and others of it is also available on the Hyde Institute. If it's okay, I may put the web links in the chat if I can do that.
Okay, excellent. And I know I had pointed out earlier that the information is evolving. We're learning a lot more about since we first discovered that ACEs, adverse childhood experiences, could be something that we could start helping develop some protective factors for. And so I have seen many websites pop up. ACE is too high, by the way. But of course, the National Responsible Fatherhood Clearinghouse website, fatherhood.gov, is a great resource if we're looking for information on ACEs. Hector or Sheehan, have you, by the way, come across any websites that you'd like to share that do touch on the ACEs?
No, I think that there's many places that discuss ACEs and do that. I wouldn't feel comfortable saying like this is where the definitive place is to find this concept. I just know that many people are speaking to how ACEs is impacting distinct communities, right? So I think hopefully the CDC website that's provided by Dr. Perry will guide people to yet more links that provide good information.
Perfect.
And also, when doing a lit search, you can tie it to the specific either behaviors or conditions that you're interested in, so you can get more specific. The CDC has great information that Armand shared, but if you're looking for more in depth, you can look into particular disorders or behaviors within parenting behavior.
Excellent, excellent. I will add one more. The Harvard Center on the Developing Child has some extraordinary information for both parents and practitioners on adverse childhood experiences and toxic stress as well. We do have another question, and this is about something called PACEs. That's PACES, and the huge impact of positive parenting practices. So maybe we can get some feedback on that specific issue of parenting styles and positive parenting. Will one of you maybe jump in on that?
I'm glad to jump in there as well. In some of the research that I found, it speaks to the idea that in similar ways that negative childhood experiences or ACEs lends itself or is associated with trauma and challenges with mental health, that positive childhood experiences are connected with the sort of buildup of healthy mental health and resilience. And so some of the positive childhood experiences are things like having the ability to talk with family about feelings, the sense that family is supportive during difficult times, enjoyment and participation in community traditions, things like feeling a sense of belonging in school, feeling supported by one's friends, feeling safe and protected by an adult in home, and then also having at least two non-parent adults who are perceived as genuinely caring for a person. Those are things that have been associated with resilience and healthy mental health into adulthood.
That's very, very good information. And I think bringing up the word resilience is also very helpful. I'm sure that we can follow up by sending out, and there will be afterwards, the NRFC will be sending out the video recording, takeaways, and resources. And I think the issue of resilience is something very helpful, because this is something people can do in their own homes, is find out what are the ways to mitigate some of the negative outcomes for children. So thank you, Armand, that was perfect. Does anyone else have any input on the specific topic of how positive parenting can have an impact?
Well, positive parenting also can have a direct impact on the attachment styles of the child, for how the child understands interpersonal relationships as they develop throughout adulthood, and even levels of understanding themselves in relation to other, like they're building up their self-confidence, and like you mentioned, resiliency, coping, agency. All these things can be products of positive parenting behaviors.
Excellent, excellent. Okay. Just for a little clarification, it's not as simple as it sounds, but there are 4 basic parenting styles, which there are way more than 4. But basically, when we say positive parenting, if we're looking up research and we're trying to find information or classes on positive parenting, it's also called authoritative parenting. There are a lot of different names for it, but it is fairly easy not only to find reading materials, but classes and online information on positive parenting. So I am very glad that someone brought that up. There is another question, and this is about family history. Family history in parenting sometimes affects how we parent our children. And this person brings up, these can be very disparate. These can be very different in the influences in a child's life, that you have people who are parenting apart, and their family history comes and has an influence on how, can have an influence on how the child is being parented. So I'm wondering, Hector, what would you say about that issue?
Well, so I sometimes worry about when we subjectively look at other people, so I'm going to speak about my personal history, so not anybody else's. But I do always worry about whether I'm reflecting my examples of learning how to parent and the reflections of my family history and kind of imposing them on other people. So when I see somebody else do something different, well, we didn't do that in that manner. Consequently, you may be doing it wrong. But I do know that when we look at family histories, and so, for example, sometimes the most clear one was corporal punishment. And when you hear narratives about corporal punishment that I heard my mother speak about, my father speak about, I know that the way I was parented was profoundly different than the way that their parent was parented and they were parented. So but if you were to look at it at how they did it, then you would say, oh, well, they didn't do it right because maybe they relied on corporal punishment and they shouldn't have done that. And when you look at the continuum of where they started to how they did it, I think it was a profoundly transformational way of parenting. And consequently, I and my partner and wife, we chose to do something yet more to not do that, right? But I always have said that, we're on this continuum of growth as a family, not just my family, but other families. And so if I'm learning from people that I respect, people that I trust, then that will motivate me to understand how I can impact that, and both Dr. Perry and Dr. Fisher have alluded to, that we can learn and we can acknowledge family parenting differences. And it's hard when you're in relationships with other people because everybody has their own history. But part of it is, I think, infusing an understanding of how family history influences us. What we learn is on the table. And maybe we as parents decide, I want to remove some things from the table, or maybe I want to push them just to the margins of the table in the hope that our children are no longer impacted, especially from those negative things. And sometimes we look at family history only through a negative lens, right? But there are some really also part of our family histories in many instances, some really favorable things that we should be looking at as things that we want to employ now, right?
Thank you, Hector, for bringing up the point that family history doesn't necessarily mean that we're going to repeat the sins of our forebears, but it could mean good things, obviously. Many, many beautiful things that are passed down in families. So, but obviously that's a big, big, big subject. But I want to thank everyone. I would ask the attendees, thank yourself for coming because time is very precious. I want to thank the presenters for the extraordinary work they do, their commitment to the issue of strong fathers and families.